So now you'll have to accept there'll be a button that says we're recording, and welcome to Talking Data Equity. I am very, very happy to see you. My name is Heather Krause, and I am a mathematical statistician and the founder of an organization called We All Count, which focuses on embedding equity in any type of quantitative data project. And you have found your way to probably my favorite thing that we do, which is an event called Talking Data Equity. And Talking Data Equity is an event that is pretty close to weekly. We do take breaks. We've been on a break for a couple of weeks now. But you can always find the full update on what is happening at Talking Data Equity, who the guests are, where the recordings are, submit questions, suggestions for guests that you want to see at the Talking Data Equity homepage. I just put the Talking Data Equity homepage link into the chat. And you will always be able to see what's happening this week. And you can also put your suggestions for questions and guest speakers into that page. And I'm so, so grateful for all the people who did just that, who responded to our request for suggestions for upcoming Talking Data Equity. Since we're just kicking off the new season today, I'm going to take you over to that webpage and show you all the cool, exciting things that we have coming up. Today, we're going to talk a little bit about causal analysis and how to get direct community input into causal analysis. But we have tons and tons of special guests coming up, almost all of whom you folks have asked for. And that includes a talk next week on racism and health and housing data from Molly Azin. We have Frank coming to talk to us about accessibility and data viz. We have Dr. Hilliard coming to talk about race and genomics in a really accessible way. August 9th is going to be super cool. We have somebody from NASA joining us on the 16th to talk about a new NASA initiative about making earth science equitable and available to people outside of the earth science specialty. We have John from the Urban Institute. John regularly attends and participates in Talking Data Equity. He's going to come by and share some of his expertise. We have stuff about social determinants of health in small areas, the new MENA categories for the US Census, measuring violence, multiple selection race. We have a lot of things coming up. And the reason that we have so many great things coming up is that you folks made some fantastic suggestions at our kind of end of the spring and summer request for input. So keep those suggestions coming. We have Talking Data Equity as a place for anybody from any country, from any sector, who is working to find practical, real world ways to increase the equity in their data projects, to come together, to learn about some concrete practical tools and examples, and to realize that you're not alone. Now more than ever, it is important for us to kind of be able to connect with people that are working on data projects, that are paying attention to the values and the lived experiences that are getting prioritized. So feel free to keep reaching out, letting us know what topics you want to cover, what people you want to hear from, and we will keep bringing those folks in. Last thing I'll say is that we do record this and we share the recordings and as many resources as possible in our Talking Data, our We All Count Data Equity Community Forum. And I've just put the link to the community forum into the chat as well. And that is not a membership site. You don't have to pay money. It's publicly accessible. It's a great place to watch old videos of Talking Data Equity, as well as have conversations and discussions with people who are working in your sector, people who are trying to figure out what to do with data that you might use as well, how to ask survey questions, how to visualize complicated equity issues. And you're more than welcome to ask questions or share ideas there as well at any point. So that's kind of the reason that We All Count and Talking Data Equity exists. And Talking Data Equity happens most Fridays. It's an informal gathering. You can see that we're hosting this as a meeting, which means you have control over your microphone. You can turn it on and off as you'd like. And sometimes we talk about a specific technique. Sometimes we have a guest speaker. And today is the former. We're going to talk about a highly requested technique today. And we're going to talk a little bit about causal analysis and how to conduct a statistically rigorous, scientifically useful causal analysis that at the same time can incorporate community input. And I'm going to share some slides. I'm going to share a couple of examples, and then we're going to work on an example together. So if you have questions, for some reason, I can't see my Zoom chat. Let me see if I can fix that. 1 second. Where is that? Huh. All right. I'm just going to take 1 second because I cannot see the chat. I can see you, but I cannot see the chat. Where's the Zoom chat? Okay, great. All right. We have fixed it. Can you tell that my tech team is on vacation? Yes. All right. So feel free to ask questions in the chat at the beginning while I'm sharing the examples. And then when we work on the example, feel free to raise your hand and turn your microphone on and ask questions and share your ideas. All right. So I'm going to spend a couple of minutes doing a little bit of level setting, because here at Talking Data Equity, we have people who are very advanced technically using statistical analysis every day in really complicated ways. And then we have other people that make decisions and make strategies based on data, but they're not actually kind of building statistical models. So I want to make sure that we have a little bit of common. Thank you for the compliment to my tech team. They are great. It's too bad they're not here. And so let's talk about what causal models actually are. And then let's talk about how we can build them in collaboration with non-technical community folks. So a causal model is when we are trying to answer a question like, did that just happen? Did a change occur? Is one activity causing something in a different outcome? What's important about a causal model is that usually we're trying to understand a little more than did a change happen. We're trying to understand why that change happened. We're trying to understand how that change happened. We're trying to understand whether a change happened because of a change in something else, maybe a thing that we did, maybe an activity that we funded, maybe a policy that occurred in the jurisdiction where we're living. That's what is usually unique about causal analysis. And in terms of data equity, it's really important to be able to tell the difference between when we're trying to do a descriptive analysis. We're trying to say, is there a difference in, say, food insecurity rates in 2020 and 2024? That's a descriptive question. Did the food insecurity rate change is a descriptive question. Did a change happen because of the thing that we care about is a causal question. So did the food insecurity rate change from 2020 to 2024 because of new activities that our food bank is doing? That's a causal question. Or because of a new national policy on how we distribute governmental food supports. Those are causal questions. So there's a big difference between a descriptive question and a causal question. And what we're going to talk about today is building causal models. And how you do that is different than if you want to answer a descriptive question. So it's important that we kind of level set there. And the next thing I'm going to talk about is what kind of elements go into a causal model and how we can look at those elements through the lens of giving community members who are impacted opportunities to help us build and make actual decisions when building causal models. So most causal models have some kind of outcome or indicator or metric that we're trying to understand. So in the example I just gave, the outcome that we were trying to understand is food security rates. Lots of times this is called the dependent variable. It is not always called the dependent variable, but lots of times it is. And the other kind of main element in most causal models is the thing that we care most about. Sometimes it's the thing we can control. We can have a whole nother seminar where we talk about whether or not we actually have control. But for example, if we're trying to understand, did the new policy in our state have an impact on or change the rate of food insecurity? Then the thing that has changed, the thing that we are most interested in, the thing that we have control over is the independent variable. So again, not everybody calls it the independent variable. There are lots and lots of other terms. There's no single right term. But for today, we're going to call it the independent variable. And because the work that most of us here do is like concrete in the real world work, there are lots and lots of other variables that we need to think about. So for example, if my independent variable is a new program that my local food bank is undertaking, that's my independent variable. My dependent variable is food insecurity rates. And I want to do a causal analysis because I want to see, did our new food bank program change the levels of food insecurity? In order to build a causal model that gives me a useful real world answer to that question, I have to somehow use data, use math to take into account that there aren't just two things in the world, my food bank's program and food insecurity rates. There are lots and lots of other things, right? We talk about that all the time in Talking Data Equity. And there are three general categories of other things that we need to take into account when we're building these models. These are not the only three things, but these are three really important things. And the technical name for these three things are confounders, mediators, and moderators. Now, we do not ever have to teach these words to the communities that we want to interact with. If these words aren't useful to you, that's okay. If these words are familiar to you, that's okay too. But essentially, from a mathematical perspective, when we're going to include other variables in the construction of our causal model to give us an answer to the question, when we're thinking about how to include other variables, there are kind of three mathematical ways to include other variables. And I'm going to step back for a minute and I'm going to show you an example that's different than the work that most of you here do. It doesn't involve the same kind of ideas and concepts that you do, which might make it a little more simple for today's activity. Let's say that we have a new kind of fertilizer. I've developed it, I'm very excited, and I want to know, is it improving plant growth? So I want to answer the causal question. Does my fertilizer cause an improvement in plant growth? So that's my causal question. I have my independent variable, my new fertilizer, my dependent variable, plant growth. And because this is a real world practical question, I need to take into account the reality that there are all kinds of things going on on my farm, in my fields, in the environment that are also going to need to be taken into account in my causal model. For example, there's rain. Sometimes it rains, sometimes it doesn't rain. And rain matters in terms of my causal model. The reason that rain matters is that when it rains, that dilutes my fertilizer. And in this case, it's really good for my plant growth. This type of model is usually called a confounder. It does not have to be called a confounder. There are lots of other words for it. You do not have to know or even ever remember the word confounder. But what is useful is to remember that there are some variables that you'll want to include in your causal model, like rain, that are going to impact both your independent and your dependent variable. There are other kinds of variables that have a different relationship. Birds, for example. There are tons and tons of birds on my farm. And turns out that when I spread around my new fertilizer attracts more birds. So there's a relationship between my new fertilizer, my independent variable, and these birds. And when the more birds come to the fields where I've put my new fertilizer, the birds eat the plants. So the birds are changing in a meaningful way the outcome, my dependent variable, the thing I care about. So I'm going to want to account for that somehow. When I'm trying to figure out, does my new fertilizer work? If I don't account for birds somehow, I'm not going to have a very useful answer to, does my new fertilizer work? Because I'm going to have missed something important. Last thing I'm going to show you is one other possibility. Maybe the acid level of the soil or the pH level of the soil really matters for the relationship that I care about. Again, I'm not trying to study soil pH. I'm not really interested, but I have to pay attention to soil pH because when I put my fertilizer on different levels of pH, different types of soil, there are going to be different outcomes in terms of my plant growth. So this is called a moderator effect. And what it means is that the relationship that I really care about between my fertilizer and my plants, that relationship is different depending on the type of soil that I put my fertilizer and my plants into. In my example, if I put my fertilizer and my plants on a really high pH field, this relationship is negative. And if I put my fertilizer and my plants on a low pH field, this relationship is positive. So the pH, the acid level of the soil, doesn't exactly affect directly my fertilizer or my plants, but it has a really important impact on the relationship that I care about. So I have to think about that as I'm building my causal model. Or again, my results are not going to be useful. And this is why this matters. The results are not going to be useful if we only measure the simple relationship we care about, fertilizer and plants. We have to think about these other things. Now, that's kind of the primer, the quick, very oversimplified, but useful, hopefully, primer on causal models. And here we're going to get to the equity part and the community involvement part. Because, for example, let's say that we want to include another variable that we know is happening. And let's say that that variable is bugs or insects. We have three options about how we're going to include bugs or insects into our causal model so that we can have a really useful relationship our result about does this fertilizer work is going to be grounded and real. We could say, okay, we're pretty sure we have a hunch that bugs are kind of like rain, and that when we put our fertilizer and our plants into soil, the bugs that are present eat the fertilizer and eat the plants. So we better control for bugs as a confounder, the same way we're going to control for rain. Or we could make a different case. We could say, no, our theory is that bugs are more like birds. Our fertilizer attracts bugs, and the bugs eat the plants. So we need to control for bugs. We need to include them in our causal model as a mediator, same way as birds. Or we can say, nope, we're going to include bugs as a moderator, the same way we included soil pH, because the relationship between fertilizer and plants is going to be different depending on how many and what kind of bugs are in the soil. And when we make this decision, the actual math that we do is different. The way that you mathematically put together data is different if you're including bugs as a moderator, a mediator, or a confounder. So the math is going to be different depending on how we want to incorporate our data on bugs. And here's where it is an equity issue, because we cannot almost ever use the data that we have to decide where we should put bugs in this model. The way we decide where we should put bugs in this model is our opinion about how the world works, our lived experiences about how the world works, the other things that we may have read in maybe journals or textbooks, or, growing up on the farm, hearing our parents and grandparents talk about bugs, what other researchers are saying about bugs. All of our lived experience, all of our gathered knowledge informs our subjective decision about where bugs should be. What is our opinion about the way the world works? What is our mental model or our conceptual model about how the world works? That is what determines which variables go where in a causal model. So this is why the equity issues involved in a causal model are huge. Causal models try and do very, very many things to say that they are, quote unquote, like we're controlling for this, or we're controlling for that, or we've taken into account, all of the other things that could have caused these differences in, for our example, fertilizer and plants. But the way that every causal model in the world does that is subjective. Causal models are a mathematical representation of an opinion about how the world works, an opinion about what matters. So it is very, very important that when we're deciding what opinions to use, what things we should control for, birds, water, pH, bugs, and how we're going to control for those things, that we think about who's going to get prioritized, who gets to have an opinion about that, who gets to make a decision about that. It's definitely not enough when somebody says, oh yes, we tested the effects of this new policy on the financial inclusion of people who don't have a college degree. And then they'll say something really casually like, yes, we've controlled for sex, or we've controlled for gender. That casual statement is a huge value-based judgment, and it's not enough information, because there are lots of different ways. We've looked at 3 really, really basic, straightforward ways to control for variables in a causal model. And the way that you do that is really going to change things. I'm going to show you one other example. This example is going to be much more quick than our birds example. And then we're going to work on something together so that you can have some practice and ask some questions. So let's say that instead of birds and fertilizer and plants, that we have a new way of delivering healthcare in our jurisdiction, in our community. It's called the Indigo Healthcare Program. This is not a real program. So if there is a real program that exists that's called the Indigo Healthcare Program, that is a coincidence. And we have an idea that the people who get to be part of this new healthcare program are going to have a better chance of getting the correct health diagnosis for the infants in the community. One of the things we're trying to address is the fact that the infants in this community are having, this is loosely based on an actual healthcare program that's happening in a country outside of the United States and Canada. And there's a lot of problems with getting the infant diagnoses correct. So this new program is hoping to increase the accuracy and correctness of diagnoses for infant populations. So that's what we care about: independent variable, Indigo Healthcare Program involvement; dependent variable, increase in correct diagnosis for the infant population. What are all of the other things that we're going to have to take into account as we build this causal model? And how do we take them into account? There's two really important questions. So in this case, it was really, really important that we didn't just rely on the lived experiences of the research team. This research team was largely from Canada and the United States. And as I mentioned, this healthcare program was in a country that was not Canada or the United States. So we knew we couldn't rely only on the mental models of the research team or other researchers. We needed to actually go and talk with people who were living in the community, who were receiving healthcare in the community, who had infants that needed to be diagnosed, or who were doctors who were doing the diagnosis, or who were other members of the medical team, the health team that were kind of not making the diagnosis, but were related. And so we went in and we collected lots and lots of different possible things that we might want to control for, like the birds, the rain, the pH in the plant example. And then we had conversations, physically concrete conversations about what the kind of world map looks like from various points of view. So again, I'm going to go through this really quickly so that we can work on one of these examples together. So again, what we're trying to understand is this relationship. Did this new health program cause an increase in correct diagnosis? If we only looked at these two pieces of data, very naive, very simple causal model that doesn't account for anything else that's going on in the world, we found out that actually, yes, this new health program does increase the correct diagnosis rate for the infants by at least 10%. Now, that's very nice. It might make us feel happy and good, but it's not all that useful, right? Because we're not controlling for any of the things that exist that are influencing what's going on in the real world. So we started looking at the different factors that the people that we were working with, that the people who had infants that were getting diagnosed or were doing the diagnosis or participating in the new healthcare program, what things did they think were making a difference in and around the new healthcare program and the likelihood of correct diagnosis? And one of the things we heard repeatedly was that they believed that the race of the patient, so this is the race of the infant in this case, was related to the likelihood of a correct diagnosis. And so we collected data on that to build a causal model that would reflect that worldview, that would reflect that set of beliefs about how the world worked, because that's all a causal model is a mathematical statement about how the world works. And when we controlled for the race of a patient as a confounder, this is being controlled for in the same way as rain was. The model says yes. And I'm just going to note here, this is a conversation for another day, but we would want to dig into whether it was the race of the patient or the racialization of the patient or the racism that the patient might be experiencing. That's a very important asterisk. We've talked about that a lot in other talking data equities, so I'm not going to get into it here, but for sure, we would want to dig into what this variable is a proxy for. I'm going to skip that because I really want to have enough time to do our example. Another group of community members were much more interested in the mechanisms, the how that this new healthcare program was leading to correct diagnoses. So they wanted us to control for things like availability of appointments, accessibility of appointments, and the wait times to appointments, because they believed strongly that these types of variables were a lot like the birds were in our fertilizer model, that the new healthcare programs were changing these factors or these elements, and those changes were leading to changes in infant diagnoses. And so when we built this causal model that reflected the lived experience or the belief in how the world works of that particular group of folks, we learned very important information. It turned out that if this is kind of the way the world works, then our new healthcare program is probably not increasing the correct diagnosis by 10% or more. Then we kind of got the two groups of people together and we found ways to incorporate both elements that they were interested in. So in this case, we actually we were physically with these folks. This was before the COVID pandemic. So we did a lot more in-person work then. And we were actually working at this time with pieces of paper and pieces of felt, like FELT, like that soft kind of sticky fabric, where we would take the different pieces of fabric or pieces of paper and write down the different elements that the community thought were going to be important to how this whole thing was working. And we would write on there, like the availability of an appointment or the race of a patient. And then we would have tables have kind of like placemat style things, like bigger pieces of paper or bigger pieces of fabric, where we would simply put down the two that we cared about, the new health program and the likelihood of correct diagnosis. We'd put these two pieces of paper down on the fabric. We'd give the people in the community all of these other pieces of paper or felt and ask them to arrange them into kind of their map of how the world works. And when we included these three options, several different groups of people made a picture that looks like this. And this is actually a very sophisticated conceptual map of how the world works and how there probably is interactions between social determinants of health and actual mechanisms of healthcare delivery. And by using something simple, like, first of all, showing the community the two things that we needed an answer to: is this new healthcare program changing the number of correct diagnoses that infants are having? These are the two that can't move. These are the two that we have to have an answer about. And then allowing them first to brainstorm what are all the other elements that we should include. And you do not have to use technical terms. You never have to say, what should we control for in this model? In fact, I recommend that you do not say that. But we say, what elements, what items, what things in a person, what things in the environment, what things in the healthcare system are probably having an impact or influence the participation in our new healthcare program and the diagnosis of infants. And you will get many, many, many brainstorms. Many people will have many ideas. And our job is to write those ideas down on either pieces of paper or pieces of fabric, or whatever you're using. Or if you're not doing it in person, you can feel free to do it on a like a digital whiteboard, like I'm going to show you in a minute. And then you're going to take all of the ideas that your community has suggested in a brainstorm and replicate them, create, a couple of different pieces of paper that say availability of appointment, a couple of different pieces of paper that say race of the patient, put them around on tables and have small groups of people work together to kind of create an informal but very useful and often very accurate representation of how the world works in their experience, what their lived experience is of the various forces and elements and factors and social determinants of health, how they work together to influence the relationship that we are trying to study, which is new healthcare programs and likelihood of correct diagnosis. And we never, ever have to use a technical word. We never say the word control variable. We never say the word confounder, mediator, moderator. We don't say any of those words. Even if we're using this process with highly technical people, because sometimes we are, we really don't want to use those words because it flips people over instantly into thinking that they have to get the answer right. Or that there's something that they can do to kind of get a good grade. We're not trying to give the community an opportunity to get a good grade. What we're trying to do is give the community, give people who are going to be impacted and who are experiencing this causal model a chance to actually tell us, draw us a map of what the world feels like for you. And then if you are the person doing this causal analysis, then it's our job to take this map. Let's say this is the model that we now want to test out and translate that very, very carefully into a mathematical model, which isn't hard to do if you're paying careful attention and you're going step by step. Okay, so let's try something together. And I brought a couple of different examples and I'm trying to decide. I think we're going to do, there's a people here from lots and lots of different sectors. There's a lot of healthcare folks here. There's a lot of public sector folks here today. There's a lot of educators. But I don't think we're going to do something in a specific sector. What we're going to do is I'm going to share this link with you. This is a Miro board. There you go. So this is a Miro board. It's a whiteboard. It's the kind of thing we use a lot now if we can't be in person with the community. And but this is a kind of a little bit of a universal example. It's a little bit more complicated than the ones I showed you for my examples. But what this is we're going to talk a little bit about pay. So this is a place where equity really, really matters. You know, there's a lot of evidence that people who are experiencing racism don't get paid on equal footing with people who are not experiencing racism. And in many, many parts of the world, this is illegal. It is illegal to pay people different amounts of money for the same work just because they are different races. So there's a lot of causal analysis getting done about is race or racism. Again, we can talk a lot about what this is a proxy for at another Talking Data Equity. But is race or racism causing a difference in pay? This is essentially the question that a pay equity analysis is asking. And pay equity analyses are things that most companies in the jurisdictions that most of us live in have to do or have to be ready to do if requested. They have to be able to show that race and racism is in fact not not causing a difference. So let's pretend that we've been hired. Our Talking Data Equity Consulting Group has been hired by a company, a big company. This company has thousands of employees, and they want to conduct a causal analysis to find out whether race or racism is causing a change in pay. And we want to talk to, one of the things that always happens, because I've done a lot of these pay equity analysis, is that there's huge issues between management and employees and about what should and should not get accounted for when we're doing a pay equity analysis. Because of course, just like in our plants example, and just like in our healthcare example, we can't just build a model that has somebody's race and somebody's pay. That is too simple of a model. There's lots and lots and lots of things that are happening in your company that affect how much you get paid. And some of those things are really valid and some of those things are really not, right? So like your company, this big company, isn't legally required to pay everybody exactly the same amount of money. They're allowed to kind of have like compensation philosophies, have reasons to pay people differently. So let's pretend that you folks are the community, and we want step one, when we're letting the community get involved in causal analysis, is we want you to brainstorm all the different things that you think we should consider controlling for. So what things happen in a company that either legitimately or not legitimately, we need to think about both of those potential situations, change the way people get paid and are going to be affecting the pay outcomes in this company. You can do a bunch of things. If you want to suggest an idea, you can use the chat to suggest your idea. There's a lot of you, so maybe don't automatically unmic, but you can raise your hand. Great. Fabulous. So, yep. Cost of living is very good. Job title is very good. You guys, you folks are, you've known me for years now and I'm still saying guys. Can you believe it? Ugh. Okay. You folks are getting the hang of this. So this is exactly the way we do it, whether it's for healthcare, education, food security. Fabulous. Number of people in company. Great. And years of experience, very good. Yeah. Education, very great. Department, yeah, right. What department you're in is a legal reason that you are allowed to pay people differently. Credentials, yep. Time of hire, that is such a good idea. That's a one that people forget a lot, because that makes a huge difference what's going on in the market when the year you are hired. Ah, yes, whether or not you ask for a raise. I like that. I like that a lot. Great suggestion. All right. So you're getting the hang of this. I am not going to to fully get everybody's voice and make sure that we've kind of exhausted our list. Would take longer than we have. So I'm not actually going to be able to capture all of your ideas. You have very, very good ideas. And there's some of them I am not going to capture, but if I was doing this for real, I would make sure that we had enough time to capture all of your very, very excellent ideas. I'm gonna come down here because I have done this before, and I think you've gotten everything there. Okay. So that's step one. I'm gonna write tenure with the community. Tenure, so that's years at company. I'm gonna say that. Okay. So that's step one. Giving your community a chance to contribute ideas for all of the factors that really matter. And this is surprisingly useful because I have never once done this where the community didn't suggest variables to control for that we had not thought of. And that did not exist in the peer-reviewed academic literature, that didn't exist in the gray evaluation kind of world. This is a very, very useful investment of time. People who are living in the causal world that you are trying to capture have very, very valuable insight. And sometimes the things that they suggest are really going to be very hard to measure, or that you don't have data on. And sometimes the things that they suggest are going to save you tons of time and tons of money. So don't think that this is always going to be something that makes more work for you. It doesn't have to. Sometimes it radically improves the effectiveness of your causal estimates while dramatically reducing the cost. So if you have any possibility of doing this, go ahead and do this. Next thing that you're going to want to do is if you can be in person, take these things, just like we did in that healthcare example, and put them on Post-it notes, put them on pieces of paper, put them on pieces of felt, and give people a chance in working in small groups to actually physically move these different things around and take some time to kind of create a map, create a picture of their experience of how this world works. So let's see if there is anybody that wants to raise their hand and turn their microphone on and verbally tell me how to move these elements into what your experience is. So I'm not going to be able to physically let you do this because we don't have it set up. If we were doing this in real life, I would have a little, I'd have 10 Mira boards. I'd divide you into a small group, and I'd have the small groups work together to drag these elements around. All right. Nobody wants to unmute themselves? All right, great. We'll just do it through, oh, okay, great question. Okay, fantastic. So somebody is saying, do we have to decide whether it's a positive association or a negative association? In other words, it's a positive association, do we put it up here? And negative association, do we put it down here? The answer is, for this part, it doesn't matter. You do not have to actually say whether or not you think it's a positive effect or a negative effect. You just need to say these things are related. So in other words, if you want to say, I think that education is going to have an effect on my pay because our company pays people with a master's degree more money than my company pays people without a master's degree. Then you would put education here and you would draw a line. So you don't have to say whether you think education is positive or negative, just that it's making a difference. Okay, great. Christopher, go ahead and unmute.
So I don't know that you have this one on the Miro board there, but one of the ones I was thinking about was people had talked about social network and where you went to school. And I
Mm-hmm.
think that those two are like those plus like just the whole social piece of this, I think almost makes like a weird little nest in the middle
Yep.
that affects, and unfortunately, like it's actually kind of a feedback loop too, right? Because race is also a mitigating factor on where, like, if you were doing the other direction, race is a mitigating factor on education. So, like,
Absolutely.
it's complicated.
Absolutely. Okay. So I'm going to just pause there because you've raised a really, really important example. And a couple people are resonating with that. So let's just pause with where you went to school. That's a fantastic. So see, I've done this so many times, and nobody's ever suggested that one to me. So this is always a worthwhile activity. So there are a couple of possibilities here. I'm just going to take education away for right now, just to make this more simple. It sounds to me like the worldview that you were expressing is this one, that you were saying the way we should set this model up is that where you went to school is going to make a difference in how much you get paid. And one of the important ways to take that into account is to realize that the racism that you experience is going to influence where you went to school, and where you went to school is going to influence how much you get paid. That's a very legitimate and important point of view, worldview, belief about how the world works. And I'm just going to move this down here for a quick example, because as usual in talking data equity, we're running out of time. There are other possibilities, right? It could be that where you went to school is having a direct effect on the relationship between racism and how much you're getting paid. So, in other words, let's say that you went to where I went to school. I did my undergrad at Penn State University a long time ago, many decades ago. And the fact that I went to Penn State and I'm white might have very little impact on my pay because I'm not experiencing racism. But if my colleague who's in the very same job as me, in the very same company as me, hired the very same year as me, is Black and went to Penn State, where she went to school, let's just say she's female like I am, the fact that she went to Penn State may have a very negative effect on how much she gets paid because of basically intersectional bias, like cumulative bias. And so that means that where we went to school is going to have different effects on the race pay relationship for different combinations of races. And whether we want to build a causal model that says this is what's happening, or whether we want to build a causal model that says this is what's happening, depends on whose lived experience we're trying to center. And the reason that we need to consider both of these is, of course, who's going to get flagged as getting unfair or unequal pay is going to be different in each of these two models. Dennis, you had your hand up and I didn't get to you, and we're very, very quickly running out of time, but I want to circle back to see, Dennis, if you have anything you want to say. Thank you for being so patient.
No worries. And given that we don't have much time, I will withhold. But I'm very grateful that we have this. This is one of the favorite parts of my day. So thank you so much again.
Oh, Dennis, I'm sorry that we ran out of time. We do need a part two. Dennis, you always have such useful insights, and I am looking forward to this. We are definitely going to need part two. So I hear you all in the chat that we need part two, and that we've just barely scratched the surface because, of course, we didn't, neither of these are anywhere near a complete actual lived experience of racism and pay. But the point of today was to just give you a little glimpse into number one, causal models are very, very subjective, and you cannot use the data to confirm whether we should use this model or this model. There's no statistical diagnostic that's going to say, this is the way the world works, or this is the way the world works. That statistical test does not exist. The only way we choose between this model and this model is our belief about how the world works. And that there are ways that you can get the community involved, that you can get people with lived experiences, people with all kinds of different sources of knowledge. It doesn't just have to be statisticians or epidemiologists or professional researchers. And yes, I know that we just scratched the surface. We will do a part two. I promise you, I will commit to you right now. We will do part two. And I'm going to put the link to the mural board and the recording into the forum. And so you don't have to wait until we do an official part two. You can ask questions. I'm going to put the link to the forum here. You can absolutely start asking questions. It'll take me 2 or 3 hours to get this video up, but you can start asking questions right away and I will answer them because this is probably my number one data equity methodology thing that I care about. So I am happy to talk with you more and answer your questions. Okay. Bye, everybody. Have a great rest of your day. Take really good care of each other and take really good care of yourself. See you soon. See you next week.